Hi, I'm Dr. Dan Sindelar, and recently there was a study done that shows that the training about oral health for physicians is very minimal. And here we're finding so many things, so many diseases are connected with the oral health of an individual, and yet we have such a disconnect because physicians are not trained in how to address that part of it. And as dentists, we're in charge of this space, and it's a very important side to treating and preventing disease. It was recently reported that 90% of the physicians have virtually no oral health training in med school. 82% are uncomfortable looking into and investigating oral health and periodontal disease as an effect on the disease of their patients. And even as much as 70% are not comfortable with the simplest periodontal or oral exam in their office. So when they're taking that tongue depressor and they're looking in the mouth, they're basically looking at the throat, the tonsils. They're looking for things that are more ear, nose, and throat related than they are really orally related. And as dentists, we own that space once again, so we're really the ones that the burden is placed on. And just recently, I spoke with a senior in med school, and he stated that they had 1 hour of training, and in that 1 hour, they basically just went over tooth numbers. So this is pretty astonishing to me, but it also is a very important step for us as dentists to help physicians understand that part of their care, and also as dentists we can help train them and help them understand. We are the experts in oral health. Here we're so worried that we're not an important part of healthcare. We are the dental experts and the oral health experts. And there are so many ways you can assist physicians in incorporating this part of their care to help reduce problems with their patients. One of the primary ones I've noticed recently is in treating diabetic patients. They have so many complications in their life, and by us helping physicians understand how important that is and how to direct that with systems, they can really improve the overall care for their diabetic patients, one of the leading causes of healthcare costs and misery in our country. Another example is in preventive cardiology and heart attack and stroke prevention. We have a real important position in that area, and you can help primary care physicians, you can help preventive cardiology-based practices, you can also help cardiologists in their prevention side of their practice. One of the largest ones I'm finding in connections in my practice is connecting with physicians in the area, not only primary care physicians, but anyone who would be involved with sleep apnea. And sleep apnea has an effect on heart attacks and strokes, it has an effect on diabetes, it also has an effect on almost any disease that we all face. Most physicians have patients that are affected by sleep apnea. So we've connected with them and supply them with a good, simple solution to help reduce that in their patient population. So physicians aren't being trained in oral health, and that's not their job, that's our job. And we're in such a good place to help them with this. They will find that an excellent add-on to their care, and I see it happen every day in my practice. And you can be an integral part in helping them treat their diabetic patients, treat their cardiovascular disease risk patients, also in helping reduce sleep apnea in their patient load. And all of these are an important key to your success in getting referrals back and forth between your practice and various physicians in your area. And it's being done, and it's being expanded, and it's being demanded. So let me know what you think about coordinating with physicians. Comment below.